Women have many choices in contraceptives, whether that's the pill that you take once every single day, or a device that is placed by doctors, or even something that you place on your own each month. Hi, my name is Hallie Smetzer, and I'm going to talk to you about 3 different forms of female contraceptive. Contraceptives work by hormones being released into the body that stop the conception of a fetus. So the first female contraceptive that I want to talk about is the Nexplanon. It is a hormonal form of birth control that is placed in the arm and releases hormones at an even rate. The Nexplanon must be removed after 3 years of use, and during those years, it is found that it is 99% effective at preventing pregnancies. Some downsides of the Nexplanon is that it can sometimes wander throughout the arm, and that can be of concern. And also, some people have reported that it can cause long-term bleeding, but those all tend to get better after a couple months of it being placed. I found all of this information in an article called Nexplanon, the New Implant for Long-Term Contraceptive, a comprehensive descriptive review. The next form of female contraceptive that I want to talk about is the pill. There are hormonal and non-hormonal choices with the pill, and for the hormonal pill, there are many different choices, and all of them come with different hormones and different levels of hormones. It's more custom to your body. They find that any type of the pill is over 99.9% effective when used correctly. And by correctly, they mean you are taking it every single day at the same time. Being on the pill for an extended period of time is not recommended by your doctors due to increased health risks. Some of these increased health risks are blood clots, heart attack, or cancer. All of these can be exacerbated by smoking, increased caffeine intake, and any other bad habits. I found most of my information from an article called Effective Oral Contraceptive Pills and Malformation of Metabolic and Endocrine Parameters and Polycystic Ovarian Syndrome. The next form of female contraceptive that I would like to talk about is the IUD, or intrauterine device. This device is placed inside the uterus to help prevent pregnancy. There are 2 main types of IUD, the hormonal and copper. Both of these are 99% effective, and the hormonal can be used from 3 to 8 years, depending on what brand you get. People have reported that it can help with cramps that you get naturally from your period. And it has also been reported that people that have endometriosis and PCOS have found that it lessens the pain and symptoms that come with those. The copper can be in for 12 years. There's some downsides to the copper, and that is that it can cause long-term bleeding that tends to get better over time. And then I found this information on 2 different articles, the first one being Intrauterine Contraceptives, and then the second one was by Planned Parenthood, and it was, should I get copper or hormonal IUD? So in conclusion of all of this, women should take their decision of getting on a contraceptive or not very seriously, and then also make sure that they're looking at all the facts about which contraceptive they want to get on. The effects that these devices and pills can have on your body can affect you for the rest of your life. So make sure you find one that fits to you. And if you do pick one and it's just not working out, you can always change and try a different one. It's really dependent on your body and how it reacts, so nothing's set in stone.